Hello, it's Hooper's cat and Kitty Cat.
Hello.
Meow.
Meow.
So this is for ICU 812. We're going to build on the pandemic ideas and do a series. Occasional series about once a week, once every 2 weeks. I could do it every day if people want to send me millions of dollars on Patreon, but it'll just be about every week or every 2 weeks. We'll take an aspect of an evolving pandemic involving us and our work. And I've done a few other stuff on pandemic. And I thought I'd like to kick the series off by actually looking back at history, because history is a good thing to look back at, right?
Right.
Right. You have to talk louder than that. To articulate to the mast-hards, the mast unwashed. Anyway, so it's 2018 for those people who don't know what year it is, and often I don't, because I think I've done 2017 on videos recently. Anyway, that aside, back in 2003, which seems a long time ago, which was 15 years ago.
Is it that long ago?
Yeah. I worked in Toronto General Intensive Care Unit on nights, and Kitty, you worked where?
In the ICU at Sunnybrook.
Right. And I thought we'd talk about SARS, which stands for Severe Adult Respiratory Syndrome, okay, which turned out to be a coronavirus. It caused absolute panic in Toronto and around the world at the time. There actually didn't have that many dead, but what was significant about it was it affected hospital staff because it didn't pass that easily into the general population, but really liked to pass in hospital conditions. And yeah, so can you tell me, if you remember, when you first became aware of it?
Well, I think we just started hearing reports about it in the paper. But we were one of the first hospitals that identified cases and had a SARS floor, more or less devoted to isolating patients with fairly mild symptoms. And then the ICU had to gear up because some of those patients started needing life support, needed to be intubated. And we kept getting different information on how it was transmitted and what sort of isolation gear we had to wear. So most of the time when we went into work, it would be something different. And at first we had mixed patient population with, some regular traumas and regular sick people. And the SARS population started growing. Till by the end of the second wave, all we had was, maybe 8 to 12 ICU patients with SARS. That was it. We were closed to everything else. So we had 2 nurses assigned to a patient by then, and we had a fairly strict criteria of dressing and undressing, getting in and out of the rooms. But at the beginning, we didn't really know. So we just did our usual isolation. And we had a couple of events where we admitted patients from the floors who were getting much worse and wound up being intubated in our unit. And I remember one night, I was working nights and we were getting a patient from the SARS floor, and it just so happened they didn't come until I went home. So I gave report to the next charge nurse, and I'd assigned who was going to have the patient for that day. And when I left, they were just waiting for them to come. And it wound up about a dozen people got SARS from the event, from that one patient.
Yeah, that was a big Sunnybrook outbreak. And
I just happened by timing to not be there, because if I was in charge and the patient came, I would have been in the room. So, and it was quite frightening for those people who had SARS, because they were young, healthy people who were, sick with really high fevers and feeling kind of short of breath. And when they came to hospital, they were, stuffed in a room by themselves, and the nurses barely came in because people were quite frightened of it. And they were feeling short of breath and alone, and it was pretty frightening for them.
Yeah. Now you mentioned the second wave, right? Mm-hmm. A lot of people don't know that there was actually 3 waves of SARS in Toronto, because after the first wave, which was the initial outbreak, there was another cluster in the community and also in the ICU, which Sunnybrook and Toronto General got. But later on, by the end of August of that year, which you would never have known from the media, because the media was fairly controlled after the first 2 weeks, we actually had a 3rd outbreak at Toronto General, which was never publicly recognised on the media, which I think a lot of people don't know. So that's kind of typical with flus, and this wasn't a flu necessarily, it was a coronavirus with flu-like symptoms, but it actually hit in 3 waves. And that's kind of typical. So you shouldn't drop your vigilance because the flu seems to have gone. keep your vigilance up. You may still be getting transmission to you from the second or third wave. Some of them have 4 waves, some of them have a 1 wave. It just depends. Now, you said that everybody recovered from SARS, so you didn't have any SARS deaths on your unit?
Oh, no, we did, but not of our own staff.
Our own staff, yeah. Sunnybrook staff survived, but the death rate initially was fairly high, wasn't it?
Yeah.
For the people sick.
The first people who came in very sick, yes.
Pretty much everybody died.
We had a doctor and a nurse die, but they weren't our
Sunnybrook, yeah.
co-workers.
That was Lyndhurst, right?
Yeah, and I think the doctor was the community.
Community, yeah. So, how many roughly SARS patients did you personally nurse, do you think?
Maybe a dozen.
A dozen. I actually was at Toronto General. I kept count. I actually nursed personally 47 separate SARS patients, which again is interesting because almost within 4 or 5 weeks of the outbreak, Toronto General Medical ICU, we basically became a SARS unit over the next month or two. There was that many cases, and pretty much all of ours died. The ones that did make it actually were hospital staff from Toronto General who made it, who survived, which again is kind of interesting. The patients, like same with you, the patients were not typically ventilated geriatrics who were very disabled. They were older mostly. They were in their 20s, 30s, 40s, 50s, 60s. But generally speaking, they weren't really that sick. They were kind of normal. And then they got really sick and they died, which was the atypical presentation plus the numbers, right?
Mm-hmm.
So how did it affect you at work during it?
Well, it wasn't pleasant at all. I don't think it was frightening in some ways. You know, we had I had coworkers with families, and they'd be going home at the end of the shift to their kids, and they didn't really feel safe doing that. At one point, we were put into work isolation, where we were just supposed to come to work and go home and do nothing else.
And that was weeks, right?
Yeah. And I mean, when they phoned me to tell me that, my nephew was visiting, and actually John and I should have been in isolation from each other at home.
Whoopers.
Hooples and I should have been in isolation at home. And, you know, people wanted to avoid you. Nobody, if you were a nurse, they'd, like, jump back. You were, like, people were afraid.
People were afraid of our dog.
People were afraid of our dog. People were afraid to be near us.
How long did we walk the dog outside? And we lived in a rural area. How long did we walk the dog outside when we was wearing face masks?
Not very long. I think we gave it up fairly quickly.
Yeah, we
never ran into anybody. There was nobody around when we
Passing
walked.
cars would stop and dry off in panic.
Speed.
Yeah.
Yeah. So that was unpleasant.
Mm-hmm.
You don't know what it feels like to be afraid of a contaminant, afraid of an infection. Until you have to go into a room with someone who has it. It's scary. It's not something you want to do.
Did you ever feel threatened by it whilst you were nursing patients?
No.
I did. I actually did. Toronto General, unlike Sunnybrook, we started wearing full protective gowns almost immediately, including respirators. Sunnybrook used yellow gowns mostly, and that kind of explains to me why their staff got infected. We were fully suited up in basic spacesuits at Toronto General. However, there was one night I went in the room and we had 2 people, same as you, one helping you gown and all that stuff. And I hadn't got my face mask on. I completely forgot. And the charge nurse was hammering on the window, like, get out, right? That was a level of fear that you don't typically see in our job. We're pretty blasé about stuff like blood all over your hands.
I'm making it a bit rosier than it was. I think it was scary, especially.
Scary.
At one point they started talking about it being airborne, and if it was airborne, we didn't even have negative pressure in most of our rooms.
Whereas we did in all of ours because it was.
We didn't have a separate source of oxygen or air that we were breathing. We just had external protection, but we didn't have an air source. So I guess you certainly didn't want to go into the rooms more often than you had to, and I think we all felt very unsettled by it at first. I mean,
Do you remember what it was like? Like, how did you find out people you'd allocated to that patient and we were actually getting sick? Do you remember how you found that out?
I think a phone call.
So work was calling you. Do you remember phoning into the hotline and hearing somebody else was now being isolated and stuff like that? I mean, weren't sure whether they'd live or die?
Of my coworkers?
Yeah.
I don't remember hearing that we weren't sure whether they'd live or die.
Well, we
but
didn't know. Yeah.
I knew they were being hospitalized, and
Yeah. Some of them were pretty sick.
some of them were pretty sick.
Yeah.
Yeah, some of them were never really returned to work fully functional again.
Yeah.
Whether it's partly because they didn't want to come back to the setting, or because it took a long time for their respiratory symptoms to really clear up, because they were left feeling short of breath and less dynamic than they had been before. So it was
Now,
nice.
I recommend in any pandemic situation where you're going to wear an N95 mask that you remove all facial hair.
It's not as easy as you think.
I strongly recommend that. Now, you had a male nurse there who had a goatee, and it was implied on multiple sources that he had infected himself because of the goatee. Now, I know him, and I think that's just a crock of nonsense. What do you think about that? Do you think that might have done that to him?
Well,
What about long hair, stuff like that?
yeah. Certainly putting on these protective devices is not as easy, and taking them off without contaminating yourself is not as easy as you might think. You know, you have to do it in a certain order. You have to be careful where you touch. We're very prone to touching our face and to touching our hair and to touching. It's really easy to contaminate yourself. So you could just do it accidentally in a second, and
When you're tired and distracted.
these devices are not 100%, and like I say, if you don't put them on or take them off properly, you could easily be contaminating yourself. If something is that virulent, I wouldn't want to be in the room. I don't think anybody even now likes to go in TB rooms with patients, even though there is a treatment for it. It's not a pleasant treatment, and we know it's airborne. It's not a pleasant thing to think that you might be walking into a situation where you wind up with a significant infection that might kill you. It's not. It takes a certain amount of bravery. I think that people who nursed and went over to look after people with Ebola, that was a very brave thing to do. I don't want to ever really do it again if I don't have to.
Yeah. So, because of SARS, you chose not to go on the Ebola team, right?
Well, not because I have temperature control issues.
Yes. Menopausal. But, I mean, for you, looking back on it 15 years ago, does it still affect you sometimes at work?
Yeah. But it makes me not want to be in that situation again, because it really wasn't a comfortable work environment. First of all, you're scared a bit. You're working with coworkers that you're scared for, who have families. You're physically uncomfortable. I mean, you don't know how you sweat when you're in those rooms trying to actually do work with a very sick person. Wearing all of these layers. It's you're sweating the whole time. You feel physically exhausted by the end of 12 hours of doing that.
Now, at Toronto General, we wore running shorts and T-shirts, which I don't think you guys ever did.
No, we had scrubs in the unit,
yeah,
so we could all wear.
Cotton scrubs, so they'd just be drenched. So,
I remember
again, the environment didn't. Well, you weren't allowed to adapt to the environment in ways that would have been better for you. Whereas Toronto General, we were allowed to wear running gear. We literally had running shorts and T-shirts. So you guys were coming out of the rooms drenched.
Oh, sometimes just.
So
totally
we,
soaked.
but at least you've got running stuff on it. It's kind of designed for that. I think we'll make this a two-parter, because I really would like to talk to you about what we did to prepare for SARS, because I did do some preparing for it, even though I wasn't prepping, and how it played out for us in our family lives during the time, because it's kind of interesting.
Other than getting extra liquor dropped off at home.
Yeah, and cigarettes, which started as smoking again, but that's a whole different issue. It's surprising how stress affects you. But yeah, I think we'll definitely do a two-parter. If you would like this to be a two-parter, please give a kitty cat a thumbs up. And hope you enjoy this. The series is going to be kind of interesting. We are going to cover the major aspects of how you can protect yourself in a pandemic situation with and without modern healthcare gear. I think that's a reasonable way of doing it. We'll assume that you've got access to some stuff, and then we'll show you what we would do if you didn't. And that's all from me, and all from Kitty Cat, and all from the terriers. Mr. Bear. Mr. Bear. Say goodbye, Mr. Bear. Mr. Bear. Bye.